it's Dr. Ijadi again. We're doing sports medicine. Here today we're going to do the shoulder exam. We got Omid again here. We'll go ahead and start with the inspection part of the shoulder exam. Okay, first you like to have ideally the patient with their shirt off. Take a look at the muscles of the shoulder. You want to look and see if they're symmetric. Looking for any atrophy, any bony abnormalities at the SC joint or the clavicle, the AC joint. You want to also start with range of motion. So we'll start with active range of motion. So flexion, bring your hands up as high as you can. So the usual arc range of motion is about 180 degrees. Okay, come on down. Go ahead and do abduction. Okay, and the same thing, the usual arc is about 180 degrees. Okay, go ahead and bring it down. You could also do internal and external rotation depending on how you prefer. Internal rotation, you would ask them to go ahead and bring their hands up as far as they can behind their back. Okay, and then external rotation, you could do it two ways. One will be just go ahead and bring out your arms as far as you can. Okay, and both of those, the normal arc again is about 90 degrees. Okay, you could also do passive range of motion, so you could push their hands up through the range of motion and look to see if there's any obstruction or anything that would prevent them from going through normal range of motion. This is external rotation. Now you could also, what I like to do is hold the scapula nice and steady, go through the external rotation about 90 degrees is normal again, and then bring them down holding the scapula, and again 90 degrees, so he has a normal range of motion of the shoulder. Okay, then we'll like to go ahead and test the rotator cuff muscles. Okay, so the four major rotator cuff muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis. Okay, so we'll go through those tests now. So go ahead and bring your hands up. So usually what we like to do is an abduction about 90 degrees, 30 degrees in flexion with the thumbs down. As you can see here, this is the empty can test. We're going to be isolating the supraspinatus tendon. So don't let me push down. And you go ahead and see what the strength is and if he has pain. If there's any weakness, you may be concerned of a supraspinatus tear. Okay. Then the next step for the infraspinatus, we'll keep the elbows at 90 degrees. Okay, do not let me clap your hands together, and we're going to resist that. Now this is going to be testing the infraspinatus and the teres minor for external rotation. Okay, and again you're going to look for pain and weakness. Okay, then we'll do the belly press. So hands on the belly, don't let me lift off. And that's me pulling here. We're testing the internal rotation and the subscapularis muscle. And then the final test is another test for the subscapularis. You go ahead and do the lift-off test, which is hands at the posterior aspect. Have them go ahead and push off. And so basically what they're doing is they're lifting off against your hand, and you're looking for weakness and pain with that as well. Okay, so some of the special tests that we use is, first we'll start with the proximal biceps tendon, the speeds test. So go ahead and bring your hands up. So again, close to 90 degrees with the elbows flexed a little bit, about 10 to 15 degrees, and put a load down. Don't let me push down. Okay, and that's loading the proximal biceps tendon. Okay, looking for pain and weakness there as well. Okay, you could do the Hawkins test for impingement. So the way I like to do it is kind of a lever maneuver here, about 90 degrees. Start here and go ahead and go through this arc. And with any pain, that'll be signs of impingement. Okay, we could do the O'Brien's test. So the way I like to test the O'Brien test is a test for a slap, so a superior labral tear. Okay, and so we'll go ahead and bring hands up about here. Thumbs up initially, don't let me press down. Okay, and we're going to give him a good push there. Now, if he has pain with thumbs up, then this is not a positive O'Brien's test. This will be likely a rotator cuff issue. Now, O'Brien's test would be no pain with the thumbs up. Then we'll go ahead and bring thumbs down, and now we're going to press down and give him a good press. And that isolates the labrum. And so for a positive O'Brien's test, the thumbs up have to be no pain, pain only with thumbs down, okay? If you have pain with both the thumbs up and thumbs down, then it's most likely a rotator cuff issue. Okay, another test for the slap or the labral tear is a shear test. So you could bring them out to abduction, external rotation. You press a forward pressure on the back of his humerus to the labrum, and you kind of glide them through that test. They would have a ping and a click, and that could be a labral issue as well. All right, you could do a sulcus sign to pull the humerus head, and you'll see a little sign as the humeral head kind of divots in. That may be some inferior instability in the shoulder. You could do kind of an anterior drawer test where you kind of push and slide that humerus forward, and that could be anterior instability as well. All right, we'll also add the apprehension relocation, so go ahead and lay down for us. Okay, you're going to have them come on over to the edge as far as you can. Okay, so for the apprehension relocation, you go ahead and put them in an abduction, external rotation. Good little pressure up. If they're apprehensive there, then they may have anterior instability. So the next step will be relocating it, put a nice little pressure onto that humerus and going through that range of motion again and give them a good push in external rotation. If their pain is gone, then that's again will be a positive apprehension relocation test. Okay. There are a number of other tests, but I think these are the main tests that you should do when evaluating the shoulder. I would also always evaluate the scapula as well, so have them go through an up and down range of motion of flexion and extension, and looking at the scapula, look for any dyskinesis or changes within or winging in the scapula. All right, well, that's it for us over here. Thank you very much for watching.